Thank you for joining me today. This is Michigan Health Star. I'm your host, Aurore. Tell us about Premier Private Physicians. I met you a couple years ago. It was at that time they were calling it concierge medicine.
Sure.
I know that term means a lot of different things to a lot of different people. So I'm kind of excited because it's new changes, which we desperately need in the United States for the current healthcare model. So why don't you explain to everyone what Premier Private Physicians does?
So Premier Private Physicians operates under the direct primary care model of healthcare delivery. What that is our patients, our members pay the physician directly without involving the inefficiencies of insurance. Really, our members are people of high net worth, families, business owners, operators, and we have a very robust executive physical program with quite a few corporate clients. And what that's done is opened up the availability for people to reach their physician when they need to, 24 hours a day, have same to next day appointments, and a much more robust physical than the traditional Affordable Care Act type of free physical. The biggest differentiator between this model, the direct primary care model, and traditional insurance-driven model, which is called the fee-for-service model, is the patient panel size is quite a bit smaller. We take 500 patients, no more than 500 patients per physician, and what that does, and we compare that to a traditional primary care doctor that is in charge of about 2,500 to 3,000 patients per panel. What this does is obviously gives the physician much more time with the patient to tackle preventive measures, uncover root causes, and really build a good relationship with the patient.
Okay. Or I was under the understanding that the doctors were kind of going home to home. So it's kind of built from that now. Where does that stand?
So there are a few times that the physician will visit their patients. We do still round at the hospital when they're admitted, and we do admit to hospitals. You're right, the model did start that way, where the doc would be, like Marcus Welby and visit the home, carrying the little black medical bag.
Or Felix the cat.
Or Felix the cat. What we've learned is that we're able to treat people on a deeper level in the practice. And that was really the beginning of building the practice and building that patient panel size.
You mentioned before too that people have more access to their doctors, and I think everybody's been very frustrated with, and I know my friends who are doctors are frustrated with the 15-minute consult. They don't have enough time, they want to do more. This frees the doctor up from the time constraints. And then they have the doctor's phone number. How does that work out? They call in the doctor all the time. I know my mom's a nervous Nelly. I know people are overly attached sometimes to the medical system. Can you explain how that works out with the doctors? I mean, they just call in these doctors day and night, or?
Sure. So in the beginning, patients do have a tendency to kind of test it, if you will. If I call my doctor, will they really respond? If I text my doctor, will they really respond? There's that tendency to really test it to begin with, and then when they realize that the doctors do respond quite timely, as a matter of fact, then that kind of goes away. Nobody knows you better than your primary care physician.